towards the end. So maybe let me just start again. Maybe before that, introduce myself. My name is Ngarizani Mudau. I'm a remote sensing scientist at the South African National Space Agency. I focus on EO for sustainable urban development. I co-chair AfriGEO, South African Geo Working Group on Sustainable Urban Development. Also, I co-chair the working group on sustainable urban development under AfriGEO, and also the COVID-19 ad hoc working group. So I'll be your moderator for this session. So I would like to introduce our keynote speaker, Dr. Justin Blanford. She's a professor of geohealth and education in the Department of Earth Observation Science at University of Twente. Her research is based on theoretical geographic information science concept, where she uses GIS, big data, novel data, and technologies, along with a variety of spatial and statistical analysis methods to address broad issues related to health risk in relation to climate and climate change, examining causes and consequences from local to global, spatial, and temporal scales, and anywhere in between that is relevant to the system of study. Current projects include examining accessibility of COVID-19 vaccinations, spatial and temporal dynamics of disease risk, and the role of clustering methods for evaluating risk, and the communication of travel measures during a crisis situation. She has a PhD in biology from Imperial College, UK, where she developed a model to predict when and where to use biopesticides against agricultural pests, such as locusts and grasshoppers. Prior to joining ITC, University of Twente, she served on the board of directors at the UCG's University for Geographic Information Sciences, and was faculty head of the Pennsylvania State University, where she taught in the online MGS program. Dr. or Prof. Blanford, the floor is yours for 20 minutes keynote address. Thank you.
Thank you very much. Okay, can you see my slides?
It's still
Yes.
loading.
It's still loading. Okay, hold on.
It's still loading from my side. Okay.
Okay.
You can just set it to slideshow.
Okay, can you see that now? Is that on the slideshow?
Yes.
Okay, great. Thank you very much. Okay, let me put my timer on so that I stick to time. Thank you very much for inviting me here today. This is an honor to be here. I was asked to talk about Earth observations for supporting health. I think some of the sessions later on talk more on the tools and technology pieces. So I'd like to start with a broad overview of how Earth observation is used for different types of health studies. So to start with, a quick overview of the current state of affairs, because I think this helps put it into perspective of how Earth observation can be used for different elements of understanding health and disease risks that are ongoing. Here is just a quick image of recent outbreaks and outbreaks over the last 20 years. This is pulled out of the headings from disease outbreak news from the WHO, from the reportings just to get a big sense of understanding of what the key outbreaks have been. And as you can see, they're quite varied. Some of these are based on diseases that are waterborne diseases or vector-borne diseases, or based on different types of interactions. This next image here is a question that I ask my students who come from all parts of the world to get a sense of what types of diseases are affecting them in their home countries. Many of these are prevalent throughout parts of Africa and many parts of the world. Again, they're very different drivers that are pushing these diseases forward. Some of them are vector-borne diseases, some of them are water-related, some of them are based on food-borne diseases. So having an understanding of what these diseases are and the drivers of these diseases are really important if we're going to use Earth observations to help better understand these. And then, of course, because we are currently in a pandemic, understanding the current situation of the pandemic. And this has been an interesting way of how geospatial technologies have been used for mapping, monitoring the current situation. At the moment here in Europe, we have an explosion of cases. So we have gone into partial lockdowns once again. Getting information on different diseases in places is not easy. This is a recent publication that highlights the different diseases that have been emerging and re-emerging throughout Africa since the 1950s. Again, very different types of diseases. Some of these have been in existence in localized areas and then have spilled out. And now we've seen Zika in other parts of the world, as well as chikungunya, for example. Diseases and their outbreaks last for different durations and also different intensities. Understanding how these change over time is quite important in how we then deal with these. I like to think of diseases as an expression of change because it's usually some change that has happened somewhere that has resulted in a disease occurring, whether it's in an existing place or in a new place. So it's understanding what those changes are. Here is a list of top drivers associated with the emergence and re-emergence of human pathogens. These are changes in land use and agricultural practices, changes in human demographics and society, contamination in the environment, so contamination of our food sources, but also contamination of water supplies. And then on the back of COP26, we have climate change that is an increasing issue. And many diseases are governed by changes in climate. We see this in the seasonality of when diseases occur and not occur. At the heart of all this are three main drivers: the environment, host and host behavior, and also the pathogen itself and what that risk is. Another key one too are the policies and governance, and in some cases the inadequacy of policies, especially when things change quickly, and the governments to deal with those changes. A lot of diseases come from animals and that close interaction between the human and the host. So it's thinking of those interactions and what is changing those interactions. And you can see that to the left here, whether it's deforestation, whether it's intensified agriculture, whether it's bringing wildlife into contact and more contact with humans. And then this is also further, can be further accentuated with climate change and changes in the climate and bringing those into those environments. COVID has been a stark reminder to show us that we need constant surveillance. Getting data for long-term and for the short term is not easy. If you try to find information about certain diseases for long-term studies so that you can get a sense of how things have changed over time, this is quite difficult. Earth observation helps with this constant surveillance. And also, one thing that we have seen is that diseases transcend boundaries. And this is also because of movements of people and airflows and things like that. They don't stay in one location. So having the opportunities and data to allow us to look at things across boundaries is critical if we're going to deal with these. Health and disease is complex. It's that interaction between the environment, the health risk, and the host. So we require dynamic approaches so that we can understand what those interactions are and when those change, what is changing those interactions. I like to put this in the context, this is quite a complex image, but I think it's really important that we look at things at different spatial and temporal scales. What is happening here and now, if we think of this in terms of COVID, how COVID has affected us and the types of interventions that have been put into place to help us deal with reducing transmission. A lot of those interventions have been local. So we need to think of things both in a local scale, but also in a global scale. What happens here might be because of a change that has happened somewhere else. So then we get those connections and those movements and those flows from those other areas. And provided that the conditions where we are is conducive for these pathogens coming in, then we'll start to see those diseases taking hold in those new locations. So we need to look at things both in the short term, so the now, but also in the long term, whether that's future projections or historically. In the image at the top, the graph is an illustration of running the biopesticide model for over a number of years so that we can understand how the biopesticide model will perform in one location in a number of years. So at the start of the season, when temperatures don't change very much, the performance will stay relatively the same. Towards the end of the season, when temperatures are similar, then the performance is going to stay the same as well. But in between, when you have that change in the seasonality, and some years it might be a cooler spring and some years might be a warmer spring, for example, then that is when we need to think more about what kind of strategies we need to implement, because those can change quite dramatically from one year to the next. The types of data that we use can be for a single location. Many health studies occur at a particular location. So how can we make these relevant to other locations and also test and understand what we've seen at one location and whether the same principles apply in other locations. We've seen a rise in a variety of types of information. UAVs, so that we can get more local information. We have remotely sensed data, which gives us broader scale views. But we also have the integration of citizen science in other forms, which come in many different formats. So how can we then integrate those so that we can understand what's going on and use that to also integrate these into our models? Geography and health are very closely linked. The air we breathe, the food we eat, the viruses we are exposed to, and also how do we access health when we need it. Spatial locations and the interaction that happens in those locations is important in what the outcome of that disease or disease risk is. So understanding our environment is critical to the types of interventions that we then implement later on. Many of you here are very familiar with GIS, geospatial, and the different elements of it. I've mainly brought this in here to show that Earth observation plays a role at all these levels, from the collection of data, so whether that is extracting information, or whether we're putting the image or other data sets behind so that we can use it as a base map to get context. We can pull information out of these different types of data sets. We can integrate them so that we can understand context. And then we can also include them in our models so that we can evaluate what's going on and make predictions. And then determine what type of actions we need to take. So essentially mapping where and when diseases are occurring, who's been affected and why it's there and what the drivers are, and what possibly the solutions are for that. I like to think of taking an integrative approach. So we need to understand those ecology pieces, but also think of this in terms of how we're going to respond and what type of recoveries are needed. So having access to healthcare facilities so that we can go and get treated if and when we are ill. And then communication is critical to informing the public, but also making people aware of when and where risks are. Essentially, we all want to be healthy and we all want to live in healthy environments. So using Earth observations is critical for making this happen. Here is a few examples of some of the work that I've been involved in. So again, taking things from a continental scale or taking things that we know have taken place in the lab and then applying it so that we can see what those risks are in the real world. This is an example of malaria. So based on lab experiments, we can come up with an understanding of what those host parasite environment interactions are. From that model, we can then create risk maps. But the temporal scale at which we need to model this at will vary depending on what those host pathogen interactions are. In the case of malaria, we used hourly information to try and understand differences that might occur in different areas. So in the top here, we have Kisumu. And based on the temperatures in Kisumu, you can see that the parasite has an opportunity to continue to grow throughout the day. In Kericho, which is considered generally too cold for the parasite, if we look at this and break this down at an hourly temperature interval, we can start to see that there are opportunities throughout the day when the parasite can still grow. It just means that it will take a bit longer, but the opportunities are there. So being able to move between these different scales allows us then to adjust and view what might be going on in areas that we don't expect. Another reason then and this has been shown based on mobile phone data, too, is that you then have the introduction and reintroduction of diseases into locations, as what happens in the example of Kisumu. So the movement of people coming in and out of areas. The map here, the blue map, is actually looking at mobility throughout Kenya based on Twitter tweets, geolocated tweets. So we were able to see where people were moving. And because people don't change their user ID, we can then look at cross-border movement. So you start to then see how people are moving in and out of these spaces. We can couple it with risk maps, so then we can start to understand where parasites or where diseases are coming from and what those disease flows are and how they're moving between different locations. This is from an older study, but I wanted to include this because it shows and captures the complexity that happens on the ground. If we're going to use Earth observations, To understand health and disease risks, we need to be able to look at this and understand what's going on and how to integrate these. This is an example in Niger where people move in and out of different areas. The triggers are seasons, where people come during the dry season, come into the cities, and with that bring diseases. Access to healthcare is still a major problem. These accessibility can change by seasonality. So if we have floods and things access can get cut off. So we need to be aware of when that happens. This is a current project working with Kristen in Penn State, where we're looking at health risks in informal settlements. We use satellite imagery to help with the sampling, and also to get a better understanding of the structure within the informal settlement. Heat, we've heard a lot about heat and the global rising. We have a student, Carolina, who is looking at understanding heat effects, but at a city level. So again, we need to be able to look at this at very different spatial and temporal scales. And then water. Water is critical for so many things. Including, as we've seen with COVID, to have access to clean water so that we can wash regularly to combat the virus. But recent examples have also included using satellite imagery with machine learning to detect potential risks of cholera. So in summary, Earth observation supports all elements of health. It's very important for monitoring our environment, understanding our environment, and especially thinking and seeing what changes are taking place and what those structures are. And allows us to then look at the interactions that we are having with our environment. It enables us to take an integrative One Health approach because we've seen that diseases cross boundaries, and then allows us to make effective decisions and solutions. But one thing that I didn't hear, especially on the first day, was also thinking of the ethical considerations. We need to make sure that our outputs and the data that we are using and the maps that we're creating don't harm those that it's intended to help. It complements and that we complement the Earth observations with domain knowledge so that it's not just a technical solution, but takes into consideration the complexities that are happening. And we need to build capacity. So this is education and training. We've heard on the first day quite a lot that we have a lot of information out there and available, but we don't have the users with the skill sets yet to be able to use them, all of the data. And building community. And I think there's further discussions on that later. And it needs to be a coordinated effort. Having silos, as we had in the past with information, hinders development of and finding solutions. We need to be able to share the data efficiently and effectively in formats that make it feasible to do so. And by doing that, I think we'll be able to deal with a lot of the health challenges that we have ahead. And this is just a quick summary of being able to integrate those different elements. And that's it. Thank you.
Thank you so much, Prof. Blanford, for that insightful presentation, highlighting the need for analyzing the spatial and temporal analysis of the disease so that we understand where they are happening, how often, and everything else in between, as you indicated. You also indicated the importance of also understanding or analyzing access to health resources, services, which is also crucial during the health disasters like the pandemic that we are dealing with at the moment. Also, you highlighted the need for ethical consideration, which is also very important as we get access to high resolution data and also access to statistical and mathematical modeling of diseases. We end up getting a lot of information. So it is very important to consider the ethics around it. And also highlighting the challenges in terms of making sure that the information that is generated is being used. I think it's also one of the challenges, and I'm hoping that in the next session, it will also be discussed in great length. So without further ado, I would like to call upon our next speaker, but maybe before that, I would like to remind the participants to use the chat box to ask questions and give input as they see fit. I would like to introduce our next speaker, who is Dr. Peter Materia, who will be talking on the EO tools for health or in health. He's a postdoc in spatial epidemiology at Lancaster University and Cambridge Wellcome Trust Research Program. Unfortunately, I won't go in detail into the bio. Please do look at the speaker's bio since we don't have a lot of time. Dr. Macharia, the floor is yours. If you can compress the presentation, we'll greatly appreciate that.
Thank you for the introduction. Are you able to see my slides in presentation mode?
Yes, perfect.
Thank you. And coming after that keynote, I almost don't have anything to add. Justin has given a very good outline of what EO and health has, and given several showcases, some of which I have here. So maybe slightly different. That's the only reason maybe I would presenting this. Otherwise, there would be no need after the justice she has done during the keynote. Here, I'm going to show several case studies on how we have applied EO in health, and specifically, these would be disease mapping. And I will not want to repeat anything that she has already said, but mine would be very particular on very specific case studies on how we have used EO data for health. And my case studies are as follows. There'll be something to do with disaster response, disease mapping, future predictions for disease patterns, mapping suitability of diseases, and in this case, neglected tropical diseases, looking at disease hotspots, and also urbanization and health, though I don't have a slide on the last bit. As you'll see, this is all about disease mapping. That's what I do on a day-to-day basis, and that's why there is a slight bias. And also similar to a presentation I did during the conference we had here, hosted by RCMRD some times back. So if you are in that presentation, you are likely to see similar slides because it also dealt with climate change and health. And I'll go first to my first case studies that I have. We have a lot of disasters that we experience over time, and I want to use this particular case study here. We had cyclones in Mozambique, and so many negative impacts like deaths, injuries, outbreak of diseases like surges in malaria or cholera outbreak. But how did we use EO in this particular case here? So this is some work that was done with some of my collaborators. This is work they have already published and can be accessed. Here they were looking how access was before and after the cyclones, so that it can support response, so that we can know who is affected, where they are, how many numbers, and how possibly we can reach them. So some of the EO data that was used here was land use. And we know that mobility varies a lot with different land use. So if you are on a forest or you are walking in a city, your speeds, whether bicycling or you are walking or you're using a vehicle, the speeds will be different. So that's one of the key inputs that we have here. Then satellite data to tell us the extent of the floods that occurred, which were the damaged roads, which were the health facilities that were damaged, which roads cannot be accessed when you are walking, which roads can only be accessed when you are using a very high-end vehicle, or which roads probably you can walk without any problem. So high-resolution data from EO would be able to tell us this. And then population data to quantify those who are at risk. We know pregnant women and children are the highest one at risk in cases of such disasters. So getting such data, and we have so many bodies that are modeling such data like WorldPop, CSN, Facebook, but land cover is one of the major inputs that is used to disaggregate data so that we move people from areas that and they are not likely to be. We know people are unlikely to be found in forest, lakes, but we want to concentrate them where we have some building footprints. So all these aspects would rely on EO data, and the authors here were able to quantify what access was before and after the cyclone, and where those who are affected, where they were, and which routes possibly they can be used to access this, such people, or when they want to access care. To the next case study, disease mapping. This is some work we did in Uganda while I was at Kemri Wellcome Trust. And this, the first map here that you can see, this is malaria prevalence at community level. These were the points that were sampled, but we have interest in getting what was the prevalence in the areas that were unsampled all across Uganda. And this is in 2 different time points for the cases of monitoring over time for the National Malaria Control Program. So here, how does EO data come in? As Justin explained, we know that environmental factors will affect the dynamics of the vectors and the parasites. And here specifically, we have the Anopheles mosquito, and we know a lot of malaria species parasites, for example, the Plasmodium falciparum, Malariae, or vivax, that are responsible for transmission of malaria. I'm getting a message. My screen sharing is paused. Are you able to still see my screen?
Yes, please go to the slide where you were. I think it's fine.
Okay, thank you. So the second way here, EO data is used. We want to predict in areas that we did not sample. We don't have any data there. But if we know the climatic factors that surround that area, we shall have an idea of the relationship between the prevalence that was observed and factors that are likely to be affecting malaria in that place. And also, this data will help us in fitting a less sophisticated model. For example, we can use a stationary covariance as opposed to using non-stationary one if we didn't have covariates in this case. And here I'm just giving examples of how these factors affect malaria. For example, vegetation or rainfall for suitable breeding site. We have temperature that affects survival. We have nighttime lights that would be maybe proxy for urbanization, economic development, or in some cases it can complement population density. So if we do this within a geostatistical model, we are able to get these maps. But if we didn't have EO to provide us with such data, this would be problematic. Yes, we will end up with a map, but how well it informs policy could be questionable. Its preciseness would be a bit low compared when we have these factors to account for such dynamics. Another case study here that was done by a Malaria Atlas project is to look at how malaria would be in future, given how different aspects of climate or weather patterns have changed over years. So this is malaria here in 2017.